One couldn't help but, I think, conclude that this is a sector that isn't great at change, either culturally or practically. That after 10 years of the existence of IJBs, we're still not there yet, at least in some localities. Isn't that an indictment of the existing approach, at least in some parts of the country, and a reason to make the proposed changes? Because they are the only way of delivering a system that is consistent for young people wherever they live in Scotland. In a specific way, on the subject of transition, if we're going to get better coordination, planning and cooperation, can that only be achieved with an approach like the one that's being proposed? And doesn't it offer also the best chance of better integration of whole family support?
I feel that although we have described a number of the disadvantages, some of the obstacles which sit within the way as part of the discussion today, we've worked really, really hard over the last 10 years to try and overcome those and still to deliver the outcomes that people need. And I do genuinely feel that there have been significant successes across health and social care partnerships, not necessarily just in Dundee or Tayside, but elsewhere in that respect. Given the opportunity, though, we would love to have a landscape that enabled us to overcome some of the barriers that were articulated in the Feely report, and also to have accountability and responsibility for planning and deploying the resources for entire families and the populations which we represent. So I do feel there's opportunity there. The proof is in the detail for me.
You have to embrace the complexity and you have to listen really carefully first. And you then come to, okay, so this might make improvements. I think the problem is here that we've almost jumped to a solution, and no matter how well done the co-design work now is, you can't go to children and families and say, do you think a national care service is a good idea or not? You know, that's not their lived reality.
But then, with respect, their lived reality in too many places is that a locally delivered and designed and constructed, however you want to frame it, a system doesn't work for them. And there will be good examples, I fully accept that. But what we have at the moment doesn't work for everyone. Yeah. Isn't the only real chance here, because we heard earlier about 10 years of effort and still nowhere near being where we would all want to be, isn't this the one opportunity we have?